Hi there, I'm Denise Tiran. I'm a midwife and I specialise in complementary therapies. And many mums ask questions about aspects of complementary therapies and natural remedies. I thought I'd like to talk to you about the things that mums ask about most. Many of you might suffer from morning sickness, and it seems to be a common trend that mums think that eating ginger biscuits is the answer. We do know from research that's been done that ginger can be a very effective anti-sickness remedy. But unfortunately in ginger biscuits, there's not enough ginger and there's rather too much sugar. So not only might that make you put on more weight, but also it will cause peaks and troughs in your blood sugar and make you feel worse. So ginger biscuits are not the answer. Ginger tea made from ginger root and grated into hot water is the better way to take ginger, but it won't suit everybody, and in a few people it will cause heartburn. Sometimes it makes your sickness worse. So try it, but don't be disappointed if you find that it isn't right for you. The alternative might be to use peppermint. The only problem with ginger is that for some people it's actually not safe, and I think this is one of the messages I like to get across to mums, that just because something is a natural remedy doesn't mean it's safe for everybody. If you are having any problems with blood thinning, or your doctor has prescribed you blood thinning tablets like warfarin, then you really shouldn't be taking ginger tea, because ginger has chemicals within it that also thin the blood, and it could, in some women, cause a little bit of bleeding. So if you're not sure, give me a ring and I'll be able to talk through with you your personal medical and pregnancy history and work out whether that's the right thing for you. There are some other things that you can do anyway for morning sickness. You may have heard of the travel bands, the C-bands that are available that you wear on your wrists. It's important with those that you put them on the right point on your wrist, which is about 3 fingers up from the crease between your hand and your wrist. There's a little button on the band, and you put that on there and press on it to suppress the nausea. And the research shows that those are extremely effective. They're quite cheap, you can get them in the health food shops and the chemists, and they will help with many women and their sickness problems. So that's something you might be able to try for yourself. Other common questions are things like raspberry leaf. You might have heard about drinking raspberry leaf tea in readiness for the birth, but there's an awful lot of confusion about raspberry leaf. We used to think that it was a remedy which would tone up the muscle of the uterus in preparation for birth, so that your labour would be more efficient and that you would have a nice normal birth at the end of it. Unfortunately, the research about that was really not very definite either way as to whether it worked or not, and there is now some new research that suggests that maybe raspberry leaf has the opposite effect. So if you decide to take it, that's fine, but it may not work for you. And there are a few people who shouldn't use raspberry leaf. If you've had a caesarean section baby before, you've already got a scar on your uterus, and that's a weak point in this next pregnancy. So it's better that you don't take raspberry leaf because we don't want to do anything to stress the scar. Also, if you're about to have a planned caesarean for a medical or pregnancy reason, don't use the raspberry leaf, you don't need it, and it could actually complicate matters. If you have twins, if you're expecting twins, or your baby is in a position other than head first, it's also not appropriate to take raspberry leaf tea. If you decide that everything's going fairly normally and you'd like to take raspberry leaf because you think that it might be helpful for your birth, then you need to start it fairly early, around about 32 weeks of pregnancy. Build it up gradually. You can make a tea from dried raspberry leaves, or you can get tablets. Personally, I think the tea is more efficient and effective than the tablets, but it's very much a personal preference. If you don't like the taste of the tea, then you might choose the tablets. But start with 1 a day and build it up over a period of 2 or 3 weeks until you're on a maximum dose of about 3 or 4 tablets or cups of tea a day. If at any point you feel that your Braxton Hicks contractions, those practice contractions that you experience through pregnancy, if they feel rather strong after taking the raspberry leaf, just cut the dose back a little bit so that you're not overstressing everything and potentially causing stronger contractions. that might put you into premature labour. Raspberry leaf won't put you into premature labour, but occasionally it can feel as if you're going into labour simply because those Braxton Hicks feel a bit strong. Another question that I get asked a lot is about natural induction of labour. Mums are very worried about not going overdue, because if you do go overdue, your doctors are likely to say, let's get you into the hospital, let's start you off. And once we start you off medically, that can sometimes lead on to the need for other interventions. So not everybody likes the thought of that. So what can you do to help yourself go into labour naturally, spontaneously, and round about the right time? The first thing is not to push it, because normal pregnancy is anything from 37 weeks up to about 43 or even 44 weeks. Don't be tempted to try and get yourself into labour before your due date, because you could, quite conceivably, you could cause problems, because your baby will come when it's ready. So what can you do? Drinking raspberry leaf tea that I've already talked about is actually not a means of getting you into labour. It's a preparation that you do during pregnancy. So if you haven't been drinking the raspberry leaf, don't try it just because you need to get into labour now. Some mums think that eating pineapple is a good way of getting into labour. It's thought that there is a chemical in the pineapple which stimulates contractions. To be honest, I personally think it's a bit of a waste of time, and the research doesn't bear out this thing about having the chemical to strengthen contractions. Actually, the bromelain, the chemical, is in the core of the pineapple. So you've got to eat the middle of a fresh pineapple. You can't drink pineapple juice, and you can't eat tinned pineapple, because the processes involved in canning pineapple actually destroy the bromelain. If you're going to eat fresh pineapple, including the core, you've probably got to eat about 7 or 8 pineapples to have any effect at all. And I'm sorry to say that's more likely to cause you diarrhoea, which might get you into labour if you're lucky. But on the other hand, it can also cause allergic reactions. So do take care, don't eat too many pineapples. If you fancy eating some pineapple a little bit, that's probably fine, and it's not going to do any harm. Other things that mothers can do to get themselves into labour if the doctor is now threatening you with an induction of labour. You could, for example, go for some reflexology to a local practitioner, but do make sure that you tell them that the doctor is now suggesting that induction is on the cards for you. Your reflexologist may be able to do some specific techniques which can help to get you in labour once you've gone past your due date. Acupuncture is another good technique that can be really effective, and there are certain points, acupuncture points on the body, which are known specifically to stimulate contractions, so that can be really useful too. One concern I have is about aromatherapy. There's a lot written on the internet, some of which is good, hopefully that you find the right sources, but some is a little less good, not because what it's saying is wrong, but because it isn't complete. And there is a trend at the moment for mums to use an oil called clary sage to get themselves into labour. Clary sage is a very, very powerful oil, and it will, in many women, actually cause contractions of the uterus. It's been used in research done by midwives, including a big study that was done in Oxford, where over 8,000 women had oils in labour, massaged or in the bath. But whilst we know that it is a powerful oil for contractions, it can also cause problems if it's not used correctly. With aromatherapy oils, you do need to buy really good quality oils. It's no good going to your local high street shop and just buying something off the street unless you know that it's appropriate for you to use it during pregnancy. Don't forget you've also got your baby there, and you don't want to do anything to harm the baby. With clary sage, you really should not be using it before your due date. I can't get that message over strongly enough. It is so powerful that if you use it inappropriately before your due date, it can cause your baby to become distressed. And if you're not sure about whether clary sage is right for you now, please give me a ring and I'll be able to advise you according to where you are in your pregnancy and what else is happening. If you've had any problems, you don't want to be trying to get yourself into labour without it being under the supervision and advice of either your midwife or your doctor or me. So please give me a ring and I'll see what I can do to help you. Another problem that mums sometimes experience is the breech baby, where their baby is settling into a position which is bottom first rather than head first. Now, it is possible to have your baby vaginally with a breech presentation, but some doctors don't like the idea of that because it is a little bit more complicated for you and for your baby. So sometimes they will offer to go for a caesarean section, and I know you might not like the idea of that. The compromise that doctors can offer you sometimes is called an external cephalic version, or an ECV, which is where the doctor tries to turn the baby by massaging your abdomen and trying to get the baby's head to tilt round from the top of your bump to the bottom of your bump. There is a lot of interest at the moment in a technique from Chinese medicine called moxibustion. It uses an acupuncture point on your little toes. Now that might sound a bit weird, but in Chinese medicine, it's based on the idea that you have energy lines running through your body which connect one part to another. And there is a particular energy line which runs through your uterus and it will end near your toenails. So stimulating the point on the end of the toenails will actually pass energy up through your body. And we think that it works because it allows a little bit of give in the uterus. It also causes the baby to become a little bit more active. So a bit of activity from the baby, a little bit of give from the uterus, and with a bit of luck, that baby might turn around. It isn't successful for everybody. It's about 66% successful, whereas the ECV that the doctor does is probably about 50% successful. So you might like to give it a go. Now, what is moxibustion? It's a really rather weird technique, actually, which involves using a stick of dried herb. You light the end of the stick and blow the flame out, and then it just smokes, a little bit like a cigar or an incense stick. It does smell rather weird, actually. And you use the heat from the stick near the acupuncture points on your toes. And you have to do that treatment for 15 minutes twice a day for a week, from around about 34 weeks of pregnancy. So it's not an instant fix. Normally, if you have it done, your midwife or your acupuncturist, if you choose to go to an acupuncturist, will show you the first treatment and then teach you what to do, and you and your partner can do this at home. As I say, it will work for some mums, but not for others. And if your baby turns, then that's really good because a head-first baby is much more likely to be born normally. So if you're not sure about moxibustion, or you'd like to give it a go, but you're not sure if it's right for you and your baby, please give me a ring and I'll be able to help you.